Hey guys, welcome to anatomy. We left off with a lot of overview of anatomy. Our very last time we were all live together at the studio so long ago, pre-corona. We were making our skeleton men and women, and we had to abandon that because corona hit. So we're going to pick up with it virtually. So this is Visual Body app. I will send you a link so you can check it out if you want to. It is amazing if you want to dive into more anatomy. It's just amazing. It's a great visual. So it is an option for you out there. However, you don't have to love anatomy as much as me. We're just going to talk about the bones in this video. So to orient you a little bit, the cool thing about this one is we can zoom in, we can zoom out, and we can spin our skeleton around. So that is one of the things that I really love, is all the different perspectives that you can get here. So starting from the top, y'all remember what something more to the top of the head of the body, the anatomical term for that? We haven't talked about that super recently. Give you a minute to think of it. Superior, right? So we've got superior is up, inferior is down, posterior and anterior. This is an anterior view. If I have him flipped around, that's going to be posterior view. What view is that? It's our lateral view. Something closer to the midline is going to be proximal. Something further away from the midline is going to be distal. Reminder of what our position is whenever we're talking about anatomy is Da Vinci's man, palms facing forward, arms at your side, basically a mountain pose with palms facing forward. Okay, bone talk now. Up here, all you need to know, that's our skull. No more details needed, okay? As you come distally, because that's how we're gonna work, down the axial skeleton, which is the midline of the body, basically, and then we're gonna come into the extremities. So we've got the skull at the very top. We're gonna come down and we're gonna say hello to our clavicles here. So clavicles, we have two of them. These are our collarbones. So it's a connection from the midline of the body at the sternum, and it goes out to the shoulder joint. It is one of the only actual bony joints that attaches the upper extremity to the axial skeleton. The other connection point is on the back through your scapula, which is not actually a true joint. It's just a muscular resting point on the rib cage. We'll talk more about that in our upper extremity anatomy. So, two collarbones. Then, if you come down, you'll find, I'm going to get multi-select here. Generally speaking, if we're talking about this area of the body, we call it our sternum. And we use that word to reference all of the things that I selected. If you were paying attention super fast, you can see that there are more than one part. You have the manubrium at the top, the body of the sternum, and the xiphoid process is that tiny little protuberance at the very distal part. Just call it the sternum, heart bone, chest bone. It's where the ribs all come together and meet at the midline of the body, okay? And it gives us great protection for all the important stuff that's right deep to that, which is lungs and heart, important stuff. Okay, so you can see the ribs that we just highlighted a minute ago coming all the way down. So if you remember, think to yourself, how many ribs do we have? 12 ribs that correspond to all of the thoracic vertebrae. So you can see we have these two floating ribs that are in the back. See how they stop here? So they don't connect into the sternum, if you remember us talking about that before. But there are 12 of them. I'm going to talk about the spine for the posterior view. We're just going to make our way down a little bit more to the pelvis. And we're going to look at the ilium. So the ilium is, if you think about putting your hands on your hips, you are resting right about here. So this right here is the anterior superior iliac spine, which is a mouthful, but that is when you lay on your back and you feel in the front of your lower belly for your so-called like hip bones. there's a protuberance. That's what sticks up. We've used that a couple times with some of our exploration of things. So that's the iliac crest. Coming forward is, you're going to find the pubis. So with all of this, you've got one on each side. Pubis meets in the middle with the pubic symphysis, allowing a little bit of movement with everything that we do, every step that we take. And the last part of that half of our bony ring is the ischium. So we have an ischium on each side. This is our butt bone. Ischial tuberosity, sits bones, however you want to refer to them. That's what those are. So if you highlight all of those, that is your pelvic girdle when you add the sacrum in with it. So the sacrum is that big triangle in the back. We've got some ligaments covering up the full bony protuberance here. Hang on. I'm going to hide those ligaments from us. There we go. So now you can see more the sacrum. Posterior view. Triangle back there. Joins together the two iliums at the sacroiliac joint. Distal to that, our tiny little coccyx, aka tailbone. All right, so now we're traveling more inferiorly. We're gonna hit a big old bone called the femur. Our thigh bone, super big, super thick, super strong. It comes up into a little divot. Let's see if I can find that for you guys. Yep, so you can see there, that little indention, I guess, for lack of a better word, is your acetabulum, and that is where your femur attaches into. Okay. As we go more distal, we're going to hit our patella or our kneecap next. So you can see, obviously, we got one on both sides. That is mainly, it's just there for the quads, so it helps the quads to create the fulcrum point that they need to extend your knee, straighten your knee out, and then attaches down into the tibia at the tibia crest. Okay, next bone down is your tibia. So the tibia, the femur, the patella make up the knee joint, but we're talking just about the tibia right now. It's the main bone of the lower leg that bears weight for us. So I think it carries something like 80 to 90% of the weight of every strike of our foot on the ground. We also have the fibula, which is lateral. And the fibula, as you can just see by looking at the difference in size, it's this like spindly little thing. If you poke around right below your knee, you might find an area. It's usually kind of tender because there's a nerve that runs right there, but you might feel just a little hard spot. That's your fibula that's coming up at the distal part of the knee, and it runs all the way down to the lateral ankle, and it makes your lateral malleolus, which is that big knob that we have on our lateral ankle. The inner knob of our ankle is our medial malleolus, and that is our tibia. Really, the fibula's purpose is to allow there to be a space for muscles to attach. It doesn't transmit a lot of weight, so if you fracture your fibula, you oftentimes don't have to be non-weight bearing in order for it to heal. It will still heal just fine, whereas if you fracture your tibia, you usually have to be off of it because putting weight through it, one, is excruciating, but two, would impede healing because every time you put weight through it, nearly your entire weight is going through the tibia. So when we get down into the foot, I think I've mentioned this before, I hate the foot and the hand and the anatomy. I just think it's a very specialized area because it's so intricate. So it's more than an entry-level 200-hour anatomy. If y'all go into your 300-hour, you might cover a little bit more of the intricacies of it, or if you just really love anatomy, we can chat about it. But just know you got the ankle here. There's a couple different bones that are gonna form that. You can see here is our heel. That's our calcaneus. And then you have tarsal bones that are here, kind of like our carpal tunnel up in the hand. It's the equivalent for the foot. And then you come down even more distal, and you'll have the metatarsals and then the phalanges. So the distal part of that, these are your toes. This is where the arch of your foot is going to rest. Oh, here goes my clock chiming. Okay, so let's shrink us back down. So that is a quick trip from the skull down to the feet through the axial skeleton. It never fails that when I'm talking to you guys, my clock will chime, and it's always like a ludicrous amount of chimes. I never am talking to you at like 1 o'clock, where I'm just going to get one chime. I have a gazillion because it's 10 o'clock right now. Okay, so back up to the top. We left off the clavicle. I mentioned that the clavicle connects the arm to the axial skeleton here at this tiny little joint at the sternum. Moving out, you will find the humerus. That's our upper arm bone. Forms the shoulder up at the top and the glenohumeral joint. If you come down to look at the elbow here, you can see where you have a meeting of one arm bone in the upper arm and two in the forearm. So it should look very similar to our situation in the lower extremity. We have the ulna. If you're in anatomical position, the ulna is medial, so it's closer to the midline. See, it's sitting here. The ulna is in line with your pinky finger, your little finger. Laterally, we have the radius, and thumb go together. So back to the ulna. If you spin it around, let me keep it in frame here. If you have the ulna posterior view here, you can see, if you were just to say, put your hand on the back of your elbow, that big bony point, that's your ulna, not your radius. The radius is not involved in that back portion. And then, I'm not a very good visible body driver. I'm gonna make y'all motion sick. There's the radius here, okay? As you come more distal into the hand, it's just like the foot. It's very specialized, very tricky, more than you need to know. The carpals are here, so if you hear anybody complaining about carpal tunnel syndrome, that's happening there in that area. And then you come into metacarpals, and so that is where the arch of our palm happens, which we'll talk about in our upper extremity lecture. And then you've got the digits, or the fingers, and the phalanges. So we're going to come to the back now and cover the things that we can't see from the front, not very many of them. And the top, scapula. I love the scapula. So the scapula is the other area, or the connection of the upper extremity onto the axial skeleton, the midline. And you can see, or maybe you can't see, it's maybe hard to appreciate, it's just resting on the rib cage curvature here. So there's not a true bone-to-bone joint on the scapula and where it joins into the rest of the body. So it's kind of a muscular joint, which is both fascinating and frustrating, and has limitations and things that can be great for it, which we'll talk about when we get into upper extremity. But it has also the rotator cuff is connecting onto it in the areas here and on the front side of the scapula, which we'll talk about when we get to muscles. So scapula is posterior that we can talk about, and then looking at the spine as a whole. So visible body looks at each individual, let's see if I can get to the right one, individual vertebrae. We're not that detailed. We've got our cervical spine. We've got our thoracic spine, lumbar spine, lower back, and then you find the sacrum, which we already visited. Coccyx at the very bottom, okay? We've reviewed the spine a lot, so I didn't go into a lot of details for you there. So, crash course in bones.